Welcome to Nita's Excerpts from the Experts, 7-minute learning sessions with researchers and practitioners in the field of eating disorders, and family members and individuals who share their experiences and perspectives. I'm your host, Sarah Bowie-Keaton. This week, our guest is Dr. Natalia Orloff. She is a licensed clinical psychologist with over a decade of clinical and research experience in the field of eating disorders. In her current role, she is the provider, trainer, manager at Equip Health. Today, Natalia will be speaking about family-based treatments, or FBT. Welcome, Natalia. Thanks for being here.
Thank you. Thank you so much for having me.
So tell me about family-based treatment. What is it, and what is the evidence behind its effectiveness as a treatment for eating disorders?
Yeah, so family-based treatment, which we often call or refer to as FBT, I think is sometimes a bit confusing because people hear family-based treatment and they think family therapy. And family therapy is fantastic, and that's not what FBT is. So family-based treatment is a specific treatment for eating disorders. So I always anytime I'm working with patients and families, I really like to make that distinction that it is not family therapy because historical family therapy works a lot on communication and relationships, whereas FBT is really a treatment specific for the eating disorder. So it's a little different than how I think we traditionally think about family therapy. When it comes to the evidence base for FBT, so family-based treatment was originally developed for adolescents ages 12 to 19 with anorexia nervosa. Since the development of FBT for AN, it's been modified for other eating disorders such as bulimia nervosa and ARFID. However, the evidence for bulimia nervosa and ARFID is a little behind where it is for anorexia. It's getting there, but it's a little bit behind. As for FBT for AN, it is the standard of care. And so if you ask any provider in the field or many providers in the field, most will agree that it really should be the first line of treatment for adolescents with anorexia. In a lot of the research studies early on with FBT, they compared it to different types of treatment that are out there for eating disorders, and FBT continuously outperforms in a number of different ways. So we know adolescents with anorexia who go through a course of FBT, we see rapid and faster weight gain, which is certainly a goal in the beginning of treatment. We see less hospitalizations during the course of treatment, which is great. And we also see better rates of remission at follow-up. So about a year after treatment, kids are still doing quite well. So it currently holds the most evidence base for treating adolescent anorexia.
Thank you. And you got into the type of population that it serves best, who is it suitable for. I'm wondering if individuals don't have the family situation to participate in therapy, does it work with a chosen family?
It's a great question. So in the ideal and perfect world, right, all carers who were involved in the adolescent's refeeding would be involved. And I think as providers, we have to realize that that's not going to be possible for many, many, many patients that need treatment. Most providers will work with the patient and their family to identify other care systems that can come in and really help with the refeeding. So ideally, yes, the actual family would be great, but certainly any other supports that can come in and help is certainly suitable.
So what are some key takeaways for families that are considering FBT for their loved one?
I would say there's a couple big takeaways. So I think the first takeaway is when people hear therapy, they think, oh, you're going to feel great. You're going to have a great relationship with your therapist. You're going to want to go every week. And unfortunately, that's not the case often, at least when it comes to adolescents with eating disorders, and particularly anorexia nervosa, which is what we're really thinking about when we're thinking about FBT. And in fact, some adolescents really, really, really don't like coming to therapy and really don't have a great rapport with the therapist, at least at the start. And I think it's really important for carers and families to understand that that's okay. In FBT, we have certain tenets that we follow that guide us through all of the treatment. And one of the tenets that's really important in FBT is externalization of the illness. So we really think about the anorexia coming in and taking over the adolescent. And when we think about it that way, I think it helps us realize why an adolescent might not want to come, right? So if an adolescent comes to treatment and they're really overlapped by their eating disorder, well, then who's showing up at treatment? It's the eating disorder, and no eating disorder wants to be treated. And so it's really working with the carers and really repositioning sort of the rapport, saying the people that you're working with are the carers. The people that you need to have a good rapport with are the carers or the care system. I think the other takeaway that kind of follows along with that is the carers are the most important part of the process, at least in the beginning. So another tenet in FBT is parental empowerment, where we really lean on the care and the care system to be the ones that drive the bus. Nobody knows the family better than the carers. Nobody knows the child better than the carers. We simply know eating disorders, and this does not work unless we can come together with the carers and take their lead on what's going to work with their family. So we really, really, really need to have that good rapport again with the carers, because they're the ones that are driving the bus. And then I think probably the last takeaway that I think is really important is no huge change happens in session. The work that really makes the change is outside of session. So while we can talk about amazing things in session, it's the work that happens at the meals and the snacks and the constant exposure day in and day out to fear foods.
Individuals who are suffering from it, do they have to acknowledge that they have it for this treatment to be effective? Because it seems like the onus is more on the caregivers and controlling that environment.
Yeah, I think it's a really good question. We actually know that early in treatment, when somebody is malnourished and they have significant weight to gain, it can be really hard to recognize how ill they are, both how like physically ill they are and how maybe cognitively they're struggling. And so we really do lean on the carers, and that's really the nice part about working with a village or working with a system, is we don't need the adolescent to say, yep, I see what's going on and I'm motivated or I'm willing. You don't need that piece. The really nice part about FBT is, while that might happen in the beginning, as long as we do the work in the beginning, we get to the point where we start to see the adolescent, right? So we get to the point where that eating disorder starts to kind of like shed off and we really see the adolescent. And that's often where we see some of that insight, motivation, and willingness. It just may take a little bit of time and a little bit of nourishment to get there. And I think actually that's a really good point too, that for carers to recognize that their child doesn't need to recognize that there's a problem to want to do this, right? They don't have to have the insight that maybe we need if we were working with an adult population. We don't need that piece with adolescents, because the carers are such an integral part of the process.
The carers are going to have a lot of fortitude, it sounds like.
Yes, this is, while as hard as it is for the adolescent, at least the first bit of treatment is certainly very hard for the carers.
Well, it's incredible work you're doing. Thank you so much for your time and for sharing your expertise. And I'm sure this will be really helpful for our listeners, and appreciate it.
Thank you so much for having me.
NEDA's mission is to support individuals and families affected by eating disorders and serve as a catalyst for prevention, cures, and access to quality care. NEDA offers programs and services designed to help you find the help and support you need. Whether you have been personally affected by an eating disorder or care about someone who has, recovery is possible, and we're here to support you.